Hi, everyone. Thanks for joining us on this Saturday and happy SPD week to all of you. And I hope it was a great celebration of what we do every day. Today, we're going to be talking about education, training, competencies. Oh my, why assessment alone is not enough. Okay. We all know that everybody learns differently in our departments and everybody is taught a different way. So, what is the best way to teach? And what should our competencies and assessments in the department consist of? Is it okay for me just to read off of a sheet and sign folks off as something that they've learned? Probably not. And we're going to talk about that in the next couple of slides. So, once again, thank you for choosing Healthmark for your SPD education, and let's get into it. So, some housekeeping and disclosures. I am a presenter of Healthmark Industries based out of Fraser, Michigan. I have not received compensation for this presentation, and all opinions are those of me, the presenter. A little bit about me. My name is Rebecca Peplau, and I've been a clinical education specialist with Healthmark for about a year now. Prior to that, I've worked in many different roles within sterile processing, and my career has been just over 20 years, including some veterinary experience. I've been on several AMI working groups, and I'm currently the president of the Northern New England HSPA chapter. And I love what I do, and education is truly my passion. Our objectives for today are going to be comparing and contrasting education training and competencies in the device reprocessing. So while those terms may be used all together and sometimes in the same way, they are very different. We're going to discuss how these components work together for successful education rollouts and continued success of the department, and discuss key components for competency creation and team assessment. So let's talk about education in medical device reprocessing or sterile processing. What is your story? My story was that um, I took a class where I was well educated, but then put into the field with folks that were skilled, but some didn't want to be precepting me, and some had negative attitudes towards leadership. So, as a new impressionable employee, I fell to the opinions of them and started to think negatively as well, and ultimately kind of letting that gossip and that negative emotion sway my shift and sway my attitude and um, kind of impact my learning. I went to another facility after that, closer to home, where I was thrown into this department and kind of, yeah, you're new, you don't really know what you're doing, but we don't have anybody to show you, so just do what you want. And that was not good. Another one, it was more organized. However, it was, okay, your trainer's going to be working next to you doing their own stuff. And so if you need help, just ask them questions. But I would always have to interrupt them. And I felt like they wanted to support me, but they also felt pressure to get work done. So they felt I could feel tension. And so that's been my story when I was a new tech and my learning experience. It wasn't very great. I want you to think about yours and if you felt any patterns surrounding my story with your experience. Were there good things? Were there bad things? Are there patterns? We know it's rushed. Even when I was an educator, it was like, okay, when can you get these new hires out on the floor? I need you to get them out as soon as possible. And I think that's a big problem because we know there's a demand and we need people, but if we're not educating folks the right way, you're asking for trouble and more time getting things back to the way they need to be. So our mission as sterile processing professionals is our is to protect patients through safe instrument processing. Every person and every step impacts patient safety. So why is this relevant to education in the department? Well, if we don't have the proper fundamental education, that foundation of our house, how can we ensure that we are achieving safe instrument processing? How can we make sure that we are doing the right thing when we weren't taught the right way? So let's dive into it. So let's see what ANSI Amy ST79 2017 has to say about education and personnel. So under section 4 for personnel considerations, it starts off by talking about supervisory qualifications. So for reliable assurance of the sterility of process items, it is important that all aspects of sterile processing be performed and supervised by qualified personnel. All activities done in the department should be supervised by competent, qualified personnel. So Amy suggests that the minimum qualifications for supervisory positions, so these are the people, your leaders, should include the successful completion of a sterile processing management certification exam, demonstration of current knowledge and adequate relevant experience in healthcare related work, participation in ongoing continuing education programs or courses, and demonstration of comprehensive knowledge of state and federal regulations. So just because you are in a leadership position, it does come with certain expectations and certain levels of education that you should possess. It then goes on to talk about your regular technicians, those that are not in leadership positions, stating that the responsibility for sterile processing should be assigned by qualified individuals who have demonstrated competence in all aspects of sterile processing. Some of these qualifications include demonstrating knowledge and documented competence within all aspects of decontamination, operation of specific sterilization systems used at the facility, principles of sterilization and infectious disease transmission, worker safety, and then it also states that all personnel performing sterile processing activities should be certified within 2 years of employment and maintain a certification throughout their employment. That is also mentioned in ANSI Amy ST91, and it is something that I believe is only required in a few states legally at this point, but it is a recommendation by Amy. The document then goes on further to talk about specific types of education and training the sterile processing personnel should receive, and that includes the initial orientation covering all of the tasks in the department that they will be doing, continuous education, and in-service training on all new devices or equipment that is coming into the department. It also talks about a written program for education, including aspects of training and education related to facility policies and procedures, documentation tools for showing education was done and how the competency was verified and when, facility policies and procedures, and manufacturer recommendations. So now that we've seen the recommendations from Amy, let's talk about the science which backs the different ways of learning. Why do we learn the way we learn? Why do some people learn differently than others? How do our brains retain information? So let's talk about some of the studies that have shown that. So let's talk about the 4 different learning styles. And this is typically known as the VARC model, the visual, auditory, reading, writing, kinesthetic model. So there are other types of learning, but these are the 4 most common ways that adult learners learn. So from Robertson College, there is a test you can take on their website that tells you what kind of learner that you are. But they go into each one of these in a little bit more detail. Typically, these are the ones that most of your staff are going to need combinations of for learning. So you can't assume that just by handing them a piece of paper with follow these instructions on it might be the best way for everybody to retain and soak that in. But this is the science behind how our brains work and how we learn. So if you're ever teaching new folks in the department or even going over a new process, it's important to know how your team and how each individual staff member likes to learn or learns best. Because in that way, you can tailor the education to them to make sure that they receive it in the best way possible. So yeah, that's the VARC model. So this is a prime example of a visual tool that you can use for those folks in the department. I feel like pictures make things easier. At least for me, I'm a very visual and hands-on learner. But when you say you have a pot scissor that's 60 degrees, you can kind of visualize it, but the thing is, if you have a picture like this up on your prep and pack station, it's easier for folks to like reference a picture and get it. So this is just a simple visual tool, for example, that you could have in your department for those that soak, uh, they're better at seeing a picture of something and learning that way. So this is a study done by Alice T. Spears, which was published in the AORN Journal August 2005. And what it talks about is a hospital, William Beaumont, in Royal Oak, Michigan, which at the time in 2005 was a 1,061 bed hospital that had 36 main ORs and 10 procedure rooms. They were doing about 50,000 procedures a year, and in 2003, they processed over 6 million instruments in that department. What was coming down the pike was new construction adding 16 additional ORs and 4 procedure rooms. So they seemingly had a really good team planning for this, and they had to buy or design a new an additional sterile processing department. So with these studies and the analysis they did with a multidisciplinary team, they found that they needed 27 new hires as soon as possible. So, a critical shortage of qualified central processing technician and the opening of a new central processing department were driving forces behind the development of a CPD technician internship program at this facility. They had classes focused on the principles and practices of central processing and an OR observation, which gave the interns in this program the opportunity to see the impact that the work of CPD has on OR function and patient care and safety. The program evaluations have been positive at that time, and staff vacancies were filled with the graduates of the internship program. So this was the first of some of the studies which show that extensive not extensive, an extended period of time and a targeted focused education program works for retention and staff competency. And I believe in the study it was about 12 weeks. So I would like you guys to check that out. There is a link in my references for this, but it is a great article that Stefan Kovac sent to me a few years ago, and it will stick in my head always because if it can be done in 2005, it can be done now. Another study was done by the Ofsted and Associates group alongside the HSPA Foundation, and it was published in the American Journal of Infection Control, and it was titled Improving Mastery and Retention of Knowledge and Complex Skills Among Sterile Processing Professionals, a pilot study on borescope training and competency testing. So what they did is they designed a study aimed to develop and evaluate a new training model that supports mastery and retention of complex key skills. So they developed a protocol where there were pre-tests and post-tests administered to enhance learning during a face-to-face workshop that interspersed lectures and hands-on practice followed by homework and online booster sessions. Surveys assessed satisfaction and confidence levels. So it laid it out so that there was a combination of different methods throughout the program. So it wasn't just lecture style, it was a pre-test to find, to get the brain moving and to get it going and to get it thinking, but then also to kind of get a baseline understanding of what everybody knows, followed by a short lecture, then a hands-on activity to really drive that home, and then another post-test followed up by some other supplemental education. So those methods were showing that these mean test scores for 9 certified sterile processing employees increased significantly following the workshop. So it was 41% and then up to 84%. And then after the workshop, all the trainees identified actionable visible defects on patient-ready endoscopes in their facilities. So that showed retention. The test scores remained high after 2 months, 90%, and trainees reported higher technical confidence and satisfaction levels after training. Memory is tied to emotion. So they were feeling very good about this, and it helped them develop that confidence and satisfaction. Conclusions: this study demonstrated effectiveness and clinical relevance of a new evidence-based model for training sterile processing professionals that incorporated the pre-testing lectures, hands-on practice, or that kinesthetic learning, a training booster, and post-testing to enhance learning. This model may be applicable to other complex skills necessary for infection prevention and patient safety. So now you have another study that has documented results and quantifiable results for a specific way to integrate different types of learning in the department. So these were the key components of the study and the exercises that the team did. So step one, develop the content, define your overarching theme, determine 3 to 4 key points that support the theme, organize all content under the key points to reinforce your messages. And step two, diversify your teaching methods. So there you can see the pretest, lectures, reading, and demos, hands-on practice. So showing that you need a combination of ways to teach folks. And then step three, reinforce and expand. And for more information about this, you can check out the article for free from on AGIC, but also the Ofsted and Associates websites, ofstedinsights.com. So let's talk about training now. You need standard operating procedures to make sure that your training is effective and streamlined. Without having your SOPs, it kind of gives folks a leeway or an interpretation of policies or protocols for each person, right? So when you say you need to brush something until it's clean, one person may have a different definition of clean versus another, or you need to firmly brush this part of the instrument. How firm is that compared to another person's firm? You know what I'm saying? So standard operating procedures are an A to Z list of steps that you need to follow, and they should be as specific enough so that somebody could pick them up and pretty much successfully achieve the result from following the list. So a colleague once told me you can't teach somebody who's never made a peanut butter and jelly sandwich before to not take the bread out of the bag before they make the sandwich. So thinking of that analogy, it can be applied to standard operating procedures. So this is an example of a basic one for the receiving lift and decontam. So it lists out the purpose, so your purpose of that SOP and that process in the department. And here's the operating procedure. Use, cleaning, and maintenance will be in accordance with the manufacturer's recommendations. That should always be a part of any SOP. And also, it goes through safety things like use for transporting supplies and carts, no human riders. And so it lists down steps that you need to follow in order to use the dirty lift. So different SOPs will have different things. Here is another example of an SOP. And mind you, these are essential for training because in our departments, they're very busy. If somebody doesn't have somebody to ask a question for about something they're doing, they can always reference the SOP for guidance. And that way, if everybody has a copy of these SOPs, they're held accountable to their SOPs. So if somebody is deviating from the list of instructions and there's not a legitimate reason why, you can hold them accountable as well. So this one goes into the type of PPE that's required for the task, what equipment and tools you need, other important information. So case carts are to be processed one at a time. Do not mix trays from multiple carts. And then at the top of the page, there's typically this area that talks about what is the process, where is it taking place, the date it was created, dates revised, etc. So this is a pretty beefy one. And this is just to show the other steps or the other components of an SOP for an example. it doesn't necessarily just have to be a step-by-step list. It should, or, it's best to have other information like this present as well. So let's talk about precepting now. Precepting is something that is an incredible asset to have in your department. If you have more than one person that's training folks, having preceptors to help with the education is huge. It allows for a more efficient education workflow, in my honest opinion. There's really nothing harder than training multiple people at the same time, because everybody learns differently with different styles. So if you can have a precepting team to help with that, it's ideal. Now, you can't just make anybody a preceptor. They have to be willing to do it, and they have to have a desire to teach people. You can't have somebody who's grumpy and hates life and hates being there teach somebody. It doesn't work. That was my story in the beginning, where I was put with people that were negative. It doesn't jive well. And so you should create a selection criteria for your preceptors in the department. This is an example of one that says they should be employed in SPD for at least 1 year, minimum 6 months with that facility. Demonstrates competent practice in the assigned work area. Demonstrates the ability to make deliberate and thoughtful decisions based on scientific principles and thorough assessments. Exhibits team behaviors. Demonstrates the ability to provide both positive and negative feedback in a tactful manner. So if you have somebody that's struggling with a task, or is taking too long, or just isn't getting something the right way, you have to be tactful and patient. Patience is a virtue with precepting, and a lot of folks just don't have it, and that's okay. Not everyone is meant to be a preceptor. The biggest thing is that choosing your preceptors, it has to be somebody that wants to do it. So it is very important not to just throw precepting at anybody. They need to be somebody that's responsible and that will take accountability for that person's education and training. And the sad thing is that, in most facilities, it's not financially compensated, but in some places with tech ladders, it can be included. And it is a whole job in and of itself. And that's part of what we need to start working on. Precepting is something that is normally outside of our job description. So if you are a manager or somebody that's involved with creating those job descriptions and expectations, it should be something that you look into getting listed in your job description. It might help with some things as well. So in addition to those characteristics for picking your preceptors, you also need to roll out the education on becoming an active listener. So this goes for your preceptors, but also your students. And there are 5 key active listening techniques. So 1 is the ability to pay attention. 2, show that you're listening. 3, provide feedback. 4, defer any judgment or bias, and 5, respond appropriately. So for your precepting team or anybody in the department, we have to realize that there are certain levels of understanding when it comes to education and competency. So this little diagram is kind of a visual representative of what we need to know. So at the base of the mountain, you're just starting that hike, and so you are a novice. You have no experience, and you're just a wee little baby like that picture shows. You have no idea what you're doing in the department. Brand spanking new. So then you've been there for a little bit, and you're starting to walk a little bit like that toddler in the picture there. So you're getting up in the trail a little bit. This is where you can note recurrent, meaningful situational components, but you can't really prioritize between them. So you start to know like what's important and what seems to be a big deal, but you really don't have a full understanding of what's going on. So then we get up a bit more, and this is where you have a high school student basically beginning to understand the actions in terms of long-range goals. So you have to pick this case cart so the patient at that time can have their surgery, right? So they're competent at that point. But that just because somebody is competent doesn't mean that they understand things fully. And that's where a lot of us need to kind of go beyond and understand that. The next level is proficiency, and that's where we perceive situation as wholes rather than in terms of aspects. So you can kind of see that graphic of a college student, and they're almost at the summit of their education understanding. And then the final level is expert, where you can see in that picture, she's got all of the things in her hands and she's doing everything. She has an intuitive grasp of the situation and zeroes in on the accurate region of the problem. So, competency doesn't mean that there's necessarily a full understanding. It's not the end all be all, okay? So, the struggle is real, right? The impact of education, training, and competency. So, this figure is it's called the Brosh Pain Scale. And ask yourself, how do you and your peers impact your jobs, right? So if you look at this picture and think of the scenario of you're working on prep and pack, every tray that you have picked up, let's say 5 in a row you've picked up, have all been dirty and need to get sent back to decontam. How does that make you feel? For me, I've been in facilities like that, and it makes me mad. It makes me pissed off. And then I feel lame because I haven't been able to get my work done. And I don't want people, oh, Rebecca, she's not really doing anything. She's just sending trays back. No. So then it is not good for team morale. Right? So, poor education on the decontamination process. What level of impact would this have on your shift goals, team morale, and your ability to not make your head explode in frustration like that picture over there? It also has to deal with your education culture in the department. So, how your team can interpret those decontamination errors, or somebody clearly just may need some re-education, or maybe they weren't taught the right way in the first place. But is there acceptance for that in the department, or are people just screaming at each other and blaming whoever's next to them, right? So we really need to think about how improper or the lack of education training and competency assessment affects the team overall, because it does. So, where does the sterile processing education begin? With a strong foundation, of course. So, when we are going to be talking about the steps within sterile processing education over the next few slides, I'm going to reference the construction of a house. So, you need a strong foundation when you're building a house for everything to line up and stand tall for an extended period of time. Your house is going to fall down if your foundation isn't strong. And if your foundation has cracks in it, it's going to lead to further problems down the line. It is important to understand some definitions before we go further. The first one is training, and that's the act, process, or method of one that trains, the skill, knowledge, or experience acquired by one that trains. Okay. Then we go to in-service. That's a professional training or a staff development effort where professionals are trained and discuss their work with others in the peer group. Usually, this is conducted by a manufacturer representative or somebody specific to that medical device. Then we go to education, which is the action or process of being educated, the knowledge and development resulting from the process of being educated. And competency is a possession of sufficient knowledge or skill to do something efficiently, effectively, or successfully, right? So, how are you and your department defining efficiently, effectively, and successfully? That's something that we need to think about, those the pyramid level of the levels of understanding, because you have proficient and then expert above that in the levels of understanding. Okay. This is where we're going to compare and contrast education, training, and competency. So let's take a scenario and compare it within the three columns here. So let's talk about, I want to get these instruments clean. So the focus of education is that knowledge foundation of how am I going to clean these instruments, or the why behind why I'm cleaning. Your training of I want to get these instruments clean is going to be the skill acquisition. Your competency is going to be the integration of knowledge, skill, and behavior. So if we go down to purpose, the purpose is for education, the purpose is to explain why processes matter. The purpose of your training is to teach how to do those tasks. And your purpose within the competency column is to confirm the individual can do it correctly, consistently, and understand why they're doing it. So then you can go under format. So education has different formats, such as classroom, online modules, articles, guidelines. Training has different formats, such as hands-on practice, return demonstrations, or simulations. And then competency has different formats through observation, testing, scenario-based, IFU-based validation, etc. So this is just a high overview of looking at education, training, and competency and how they differ from one another, because a lot of the times these terms are used together when there are very different meanings behind them. So it's important to understand the differences throughout each type. So this is a little flow diagram again for the visual learners out there, right? So your education, training, assessment, and competency can be looked at in the ways of growing up, right? You're a baby all the way to an adult. And then again, when you're building your house, you need a blueprint first, then your foundation, the framing, windows, roof, etc. It's a structured plan or a structured advancement that needs to take place. So, assessing competency, the good, bad, and ugly. Assessing competency is something that requires a lot of different steps and thoughts. It's not something where where signing somebody off is effective anymore. So it should be a continuous evaluation of each step of the process. And you have to think of building the house. If your foundation isn't correct for the situation, each step of the process that follows will only compound the problems. So if you did not understand, for example, that your trays going into the ultrasonic need to be free of gross debris and soil before going into the cycle, because cavitation can be impacted by gross debris. Somebody may keep putting trays in there that haven't been rinsed properly and ultimately rendering the sonic less effective than it could be, which in turn will cause further steps of cleaning to be not as effective in the washer, and then you might have some debris that makes it over to prep and pack. So it's one of those things where each step of the process should be evaluated and signed off, and basically you want to make sure that you are observing this individual do it. There are plenty of times where somebody can say each step of the way correct, but when it comes down to it, they might miss a step during the actual moment of it. So you can use the analogy of the big bad wolf and the three little pigs. So basically they're trying to hide from the wolf, and you have somebody that's like, yeah, I'm going to build a straw house, it's going to survive. And no, it's not strong enough, it's weak. Then you have one with sticks. And it's still a bit better, it's a bit stronger, but it is not going to hold up during a storm. And then you have the one that was done right, and it's going to withstand the test of time. So your schedule for competency assessments is going to be something determined by you and your facility, but it should be considerate of any manufacturer's recommendations for competency testing, any standards, guidelines, or regulations regarding competency testing with particular medical devices. And then also it could be something where you determine, like, okay, these shavers are a high risk item and there's a lot of room for error if step is missed or something isn't done correctly. So we're going to do biannual competency assessments. Knowing how to test the eye wash station may be something that is done upon initial onboarding, and then annually after that point, because it's a little bit more low risk, and if your department determines that. So you always need to reevaluate to maintain consistency and avoid adapting bad habits into the process. During your competency assessments, you are evaluating knowledge and skills. So, if you do not have the skill in one area of the process, each step that follows will not lead to a strong end result. So, again, think of building your house. If you don't have the skill to put the frame in properly, then your windows and your walls are going to be crooked and they're not going to stand. Put that into play in your department. So if you do not have the skill or the knowledge of how to check your spray arms on your washer rack, then potentially loading of your washer may be incorrect, and subsequently the mechanical cleaning process may be less effective. So you have to understand each step along the way, okay? Or else it is not going to be efficient. So your competency should be that detailed. If you have a competency for decontam, you have to start at the beginning and then every detailed step along the way. Go through it. And again, it's as simple as looking at, okay, mechanical washing. Every part of that needs to be broken down and evaluated. So, and make them show you how to do it. You want them to. Sometimes I would have my students. Or my the new hires or the folks that I was training to try to teach me how to do it, because that showed me that they had a thorough understanding of the why behind what they were doing, but also you get that physical component so you can see if they're physically doing it the right way. An example I've seen in the field with this is, okay, well, how are you testing your washers? And some folks will explain, yep, you put the washer test on each shelf, and this is how you do it. But sometimes when they show you how they're doing it, they're not loading them correctly. They're either positioned wrong or staggered incorrect, pertaining to the IFUs of that washer test. So that's something where a sign off, it's just not something, it doesn't necessarily, you have to make sure that you've documented that each step along the way, you've observed them doing this and they can explain the why. So let's talk about the role of assessment when you are assessing your team's education. It is a tool, not the end goal. The end goal is competency, proficiency, expert level status. Um, Assessment identifies whether a person can perform a skill at a certain point in time. So you are assessing them through different periods of the education program to make sure they're hitting their milestones. So, at a couple weeks in, they should have this fundamental understanding. And then a couple more weeks in, they should be at this point. Now, everybody learns differently. And so you may need to tailor your program so that some folks have more time than others. That's just the way of human nature now and how certain people learn. Sometimes people need more time. And that's where you guys will have to find a balance of it, but you have to maybe give a couple weeks leeway. Some folks may struggle with one part of the education where they excel with others. So again, time is something that there's a fine balance of. But along each step of the way, you're going to do your assessments. And so assessments must feed into the competency framework for true assurance. Okay. So think of it like this. Have you ever tried to hang a picture like, and it was a heavy picture, right? So you need a nail, but you only had a nail, but you didn't have a hammer. What do? You find like a rock or something to try to like hit it in there. Assessment is your essential tool to reach your end goal. So the hammer is your essential tool to hang your picture, right? So you can't have true competency without assessment throughout the way of the journey of competency. So an assessment isn't necessarily competency, okay? The difference between following a manufacturer's instructions for use and recognizing that the instrument is still dirty and needs additional brushing. So think of it like this. Your assessment, can you perform this task? That is a one-time observation sign off and minimal standard of really what you need documented. Whereas competency is more than the assessment. It's, do you understand why? And are you consistently performing the task correctly? So there's ongoing verification across the different settings of the department, and you're going to demonstrate accountability, integrity, and excellence throughout. There's a saying of quality and integrity happens, if you're doing the right thing every time, even when nobody's looking. So assessment is your assessment of that person completing the task, and competency is the understanding why. This is more of an explanation of the danger of the check the box. Sign off does not equal mastering safe practice. So staff may repeat habits incorrectly. They may meet minimal expectations but miss critical details and lack decision-making ability on unusual situations. So if you're sitting down with your teammate or your staff member and going over these education documents with them, reading it off and saying, "Hey, do you understand this?" and then them saying yes, and then you checking the box is just you're asking for trouble unless you physically like put eyes on them. And watch them do it. So, I've had people in the past that have explained the process perfectly, but then when they would be left to their own accord, they would make egregious mistakes or take egregious shortcuts. So, it is a dangerous method if you haven't actually put eyes on them. Some of our educators, we're strapped, right? I've been in the department before where you have 7 new hires, and it might be easy just to be like, okay, yeah, I know, I've went over that with you, you got this, and check it off, but it's not the best practice anymore. True competency goes beyond task completion. So, when you exhibit true competency, you possess the skills of having attention to detail, understanding the why, applying that knowledge under pressure so you're able to make those critical thinking decisions in those moments, especially if it's something where the or the OR has an emergency situation and that you need to pull supplies for or turn something over quickly. You're able to process, okay, this is the first thing I have to do, this is the second, this can't be done this way because of XYZ, and consistently across time and situations. So again, that understanding the why and applying knowledge under pressure, you're aware of how much time the processes take. So think of window cleaning with this. So imagine if residual biofilm left on surgical instruments could be as easily identified as the film on windows. It's not. You need higher skills and critical thinking required to bridge that gap. However, if you're able to look at these pictures of dirty windows, you have a couple different ones. There's a difference between washing your car window and having remaining streaks or debris compared to it being clean at such a high level that there doesn't appear to be glass there, right? So you can think of it as, if you don't have true competency, you might have your windows still be dirty, but if you understand the why behind everything and the purpose of having a clean window, it's going to be streak free and clean. So, taking all of what we've just talked about into consideration, let's reflect on the big picture. Imagine the wolf being microorganisms. Which competency house would you want to represent the instruments being used in the OR on your loved one? Do you want the ones that were built without knowledge of how they would stand up during bad weather? Do you want the house that was made of terrible materials without the understanding of wind is going to knock it down very quickly? Or do you want the one that has a solid foundation, solid walls, solid roof, all of that? You want your education structure, you want your house to be solid throughout, okay? It is critical that your foundation and the walls and the structure of your competency house have been investigated throughout the whole process and that they are structurally sound. Okay, that is the only way that you're going to have success. Documentation's role. So, assessment is necessary for your records and your compliance, while your competency is necessary for safety and quality. Your documentation needs to show records of both and reflect both. So, you want to have the what was done and how it was done as far as your training, assessment, and competency evaluations have gone. And this is where we can put it into play and think about standardization. So, you have your SOPs, your standard operating operating procedures. And without them, it's hard to streamline and standardize. So an example of this is take 3 people, each choose from any size brush for a lumen instrument. Following detailed IFUs and documenting what was done and how creates accountability. So you would see if they could follow the IFU and pick the appropriate size lumen brush. And if they were not able to, you can see that there was some miss of understanding of the why of the process. And so standardization and streamlining also goes for an IFU that says brush instrument for 1 minute vigorously. How is that interpreted by everybody on your staff? Okay, so this is where your education and your competency should assess, okay, this person, yes, they're brushing vigorously, but their instrument is still dirty at the end of it. Maybe they're using the wrong brush, maybe they're using the wrong cleaning chemistry, or maybe one person's vigorously is way too vigorous for that delicate type of instrument, right? So when you have IFUs that are as bland and as there's a lot of room for interpretation as that. You need to break it down in your competency assessments and your training program to make sure that those folks are able to interpret this correctly. And when we get to our competencies and knowing that we need a lot of detail and a lot of explanation in them, here are 2 examples of competencies. You have a high level and I'm going to say mediocre, like a middle ground competency. So the green is the high level detailed competency exceeding expectations, right? So this is a stellar model. The task at hand was brushing of lumens and reusable instruments. So you can see it says performance criteria, the preparation. So the steps that have to be taken before the actual task begins. And it says reviews device IFU prior to brushing. Selects correct lumen brush diameter and length appropriate to device. Inspects brush integrity. Wears required PPE. Then it goes to specific brushing techniques. Verifying that the instrument is cleaned. Attitude and knowledge demonstrated. And it says competency met when technician demonstrates correct brush selection, technique, and inspection, and verbalizes a rationale for process. And mediocre or middle ground explanation on the right here. You have your performance criteria where it says selects a brush. Okay, you're selecting a brush, but is it the right one? Brushes lumen until it looks clean. Rinses lumen. How long are you supposed to rinse that lumen for? Are you supposed to rinse it with a specific type of water? Sets instrument aside for further processing. The weaknesses of that show that there's no mention of the IFU, there's no verification of brush type or inspecting the condition of the brush before you use it. The technique is vague. Brush until clean. What does that mean to each person, right? No step for rinsing between brush strokes, no accountability for explaining why this step is important, and it leaves a high risk for biofilm or improper cleaning infection risk. So let's look at some evidence in practice. And this is just showing the weaknesses of those 1 sign-offs, okay? Just reading over what their competency evaluations say and checking a box off. So staff who only had assessments signed off, no actual physical evaluation, continued to make errors. Staff trained to competency caught these errors before they reached the operating room, okay? So the following pictures are going to show you the work of staff members who were signed off, but they were not evaluated. So this is a Synthes small frag locking tray. This is a complex orthopedic tray that is involved with fracture repairs. There's lots of cannulated instruments and it's often used in trauma. So this person at the sink did not separate the layers. They did not put the layers through the washer correctly. You can see there is a huge amount of bioburden or a blood clot that was left there at surgery. And, obviously we know there were steps missed in the OR, but this must have been a bad case. And so while this person could recite the step-by-step process for cleaning these trays all the way through perfectly, when it came down to the pressure and the time and decontam, they took shortcuts, okay? And so it made it to the clean side like that. And another example on your right is of a skin hook where this person repeatedly used a tip protector that was too small for that specific type of hook. So, their competency said choose an appropriate tip protector for type of instrument. Nothing really pertinent about the size. So it was, again, one of those things where, yeah, they were choosing an appropriate tip protector, but the size was not correct. So what can this do? This can lead to injury in the operating room or injury within SPD. This is something that unfortunately had a negative impact. So you see a scope that was tagged of the lens being broken. The tray was also tagged as scope broken, decontaminate. So a new hire who was not trained on how to process broken instruments or what it meant that it was tagged as broken. Like, we're talking about basic education and steps here. So this person either was not instructed on the steps for it. There was not a spot on their competency that went over this. And what happened was this was a one-of-a-kind tray. This lens was needed for a case, and that patient had to wait because this was not it was not ready for them. So the patient was impacted because this tray got to the OR and it was opened up and this was broken and they couldn't use it. And so unfortunately, they had to try a different technique, which may not have been the best way for that patient. So our education can really impact lives of the patients that our instruments are going to be used on. So this is something where it should have been signed off and assessed that, okay, if you get something, what do the tags mean? You can put pictures of the tags, like we talked about earlier, at your workstations to show what does it mean. Yes, it has a priority tag on it. So that person may not have been aware of what it meant. They may have seen the priority tag and were so used to doing priority trays for this particular hospital that they just thought, I'm going to turn it over, I'm going to turn it over, because that's what they were used to in that setting, but they didn't understand what the tag, the orange broken tag on the right meant. So pictures and explanations at the stations and in your competencies, also on your SOP documents, and you can keep those at each one of your workstations. So you have an SOP for priority label tags and for broken instrument tags, and then step-by-step processes of what you need to do in each set. This is also an example of not understanding the full circle. So this is a chest spreader, as you can see. So what do you notice about it? The handle for opening it is actually facing down. So it is inside the body cavity. It was assembled incorrectly. And at this facility, their protocol was sterilizing the chest spreaders together, because of the nature of that facility. The blades were also incorrect. There were two different size blades, two different style blades on that chest spreader. So without the person's understanding of how the instrument gets put back together and how it's used in the body, they subsequently contaminated the setup. And this is another orthopedic instrument. Again, this person was not shown that this needs to be lifted down for cleaning. And so what happened was they did not, it was not cleaned properly in decontam. It was not sent through the washer properly. It was not brushed properly. And then on prep and pack, somebody else was not taught to inspect these pieces, or they they missed the step and it made it to the OR like that. So again, that's where, you need to have somebody explain the process and then show you how. You can say till you're blue in the face, yep, orthopedic trays I'm good with, but every single type of orthopedic tray has different complexities. So these specific types of instruments, you may need to make sure that you pull a Zimmer tray, pull a DePuy tray, pull a Synthes tray, and look at those individual ortho instruments that slide up, down, twist apart. It's very complex, so you need to have as much detail and as much documented training as possible. And for any educators out there that need help on creating competencies and knowledge skills assessments, this document by Amy is a fantastic resource. And so this is the picture on the left is the cover of it, and each section is divided into sections of the department, and it shows considerations for excellence. So it gives you background knowledge of the skill that you are trying to achieve your competency for. And then it goes into checklists. So this is just part of it, but it goes over how each step of how you can do your competency and details about it and your rating system of a 3-2-1. So that is critical. Again, that's a really great resource from Amy. And so our key takeaways for this are assessments are a check mark in the process. It is one way of making sure that you are on track for building the proper competency house. Remember, competency shows your mastery and accountability. And the goal is to develop employees who not only complete tasks, but also own the process and its outcomes. And if you guys have any further questions or comments, feel free to email me at rpeplau@hmark.com. And thank you very much for choosing to spend your Saturday with me, and happy SPD week. Stay tuned for a question and answer session.